Hi, this is Dr. Zawish, and today I'll be talking about how to relieve your foot pain, heel pain, and arch pain, which leads to plantar fasciitis. Plantar fasciitis is a secondary cause of collapsed arches, which leads to heel pain and arch pain, which in this video I'm going to go over some stretches which you can do at home or at the gym to release and relieve the pain as quick as possible. All right, let's begin. Okay, this is just a quick anatomy lesson about where the heel bone is, where the plantar fascial muscle is, what happens when you get plantar fasciitis, and what happens when you have heel spore as a result of plantar fasciitis. So if you look at the anatomy of the foot, I believe this is a left foot, this is a big toe, this is the heel bone, this fascia that you see is plantar fascial muscle, which starts from the heel and it goes all the way and attaches to the big toe. And this part is the part of the plantar fascial muscles and other soft tissues which makes up your foot arch. And for the people that they have collapsed arches or flat feet, this part is under a lot of strain and a lot of pressure, which gets pulled of the insertion point, which is basically in the heel, and that's why people with plantar fasciitis, they usually have heel pain as well. As the arch collapses or as the foot is flat, this part gets really strained and it's going to get pulled off the heel bone and you end up with heel pain. And sometimes if it becomes chronic, this part becomes calcified, which leads to heel spore, which shows up in x-rays. If you had x-rays from your foot and you see a bit of a spore, that's the reason for that. Now in this video I'm gonna show you how to stretch your foot, your calf muscle, to prevent this from happening, or even if you have plantar fasciitis, heel pain or foot pain, or in addition to arch pain, we can get rid of the pain very quickly, and you can do these stretches at home or at the gym. All right, let's start. So one of the ways to stretch your plantar fascial muscle, your foot and your arch of your foot, is using a roller tennis ball or a golf ball. And what you do is that you place it on the floor. You're going to be placing your arch on it. You're going to apply pressure and you're going to roll it back and forth until you get that stretch around the arch of your foot. And you're going to be repeating this probably somewhere between 8 to 10 times back and forth. And you're going to be repeating this 2 or 3 times each day. And of course, you're going to be repeating this onto the other foot as well. Another stretch to stretch up your foot, your plantar fascial muscle, is you come close to a wall. You're going to bend your ankle all the way up. You're going to lean your toes and the ball of the foot against the wall, and you're going to be lean into the wall. And at this point, you should feel a stretch alongside your calf muscle and a bit of a stretch underneath your foot, especially around where the arch is. You're going to be holding it for about 20 to 30 seconds. When you are done, you relax it. You bring the other one up. Your ankle bends backwards, forward a little bit, and you're going to lean your toes against the wall. You're going to lean your body closer to the wall. Same thing, you'll be feeling the stretch alongside your calf muscle and a little bit underneath the arch. You hold it for about 20 to 30 seconds. It's best to repeat this at least between 4 to 5 times each day to get the maximum result. When you have foot pain, arch pain, or plantar fasciitis, it's very important to stretch your calf muscle, because the importance of calf muscle is calf muscle comes and connects to the heel bone, and because the plantar fascia is attached to the heel bone, if the calf muscle is too tight, it can affect the movement of the calcaneus or the heel bone, which can actually make the plantar fascial muscles tighter. So it's very important to stretch your calf muscle whenever you have foot pain, heel pain, or plantar fasciitis. And this is one of the stretches that you can do at home or at the gym. You come close to the wall. The leg that you want to stretch goes all the way back. Make sure your heel and your foot is completely flat on the floor, and you're going to be leaning forward. Knee should be straight, and the heel and the foot should be planted onto the floor, kind of flat, and you hold it for about 20 to 30 seconds. When you are done, you go back. You're going to switch sides or legs, and same thing, make sure the heel is nicely planted into the floor, knees straight, and you're going to be leaning forward. At this point, you should feel a stretch alongside your calf muscle all the way down to your Achilles tendon and heel. Hold it for about 20 to 30 seconds, and you're going to be repeating this 4 to 5 times. The other stretch for plantar fasciitis or the arch or foot pain is you come close to a wall, just like the one that we did before. The only difference is that the foot that you want to stretch goes back, and this one you're going to lean forward, and also your knee is going to be bent, but your heel and your foot is going to be flat on the floor. And you're just going to feel, you're going to lean forward, and you hold it for about 20 to 30 seconds. You should feel a stretch alongside your Achilles tendon. You hold it for about 20 to 30 seconds. When it's done, you go back, same thing. Make sure the foot and the heel is nicely planted onto the floor. You lean forward, you bend your knees both, and you hold them for about 20 to 30 seconds. You're going to be doing this 4 to 5 times each day, and you're going to be repeating this on a daily basis. Great, that was the stretches for plantar fasciitis, foot pain, and heel pain and arch pain. You should do them on daily basis, at least 4 to 5 times, especially if you have symptoms. And each stretch, you should hold them for about 20 to 30 seconds to make them effective. That way, it will reduce your pain a lot faster. And obviously, you can do these at home or at the gym. But before you attempt these stretches, make sure you talk to your healthcare provider to make sure you are diagnosed well, and these stretches will be good for it. Otherwise, I'll be seeing you on next video. Bye-bye.